feedback that I get about secure messaging is overall very positive, and part of it is simply we finally have it. That secure messaging really allows us to compete more effectively, I think, with other healthcare systems that may have had a system like this in place already, and really gives patients that asynchronous, secure connectivity that they are used to working with in any number of other services that they use. And finally, we have it in Army medicine.
The way we had to communicate before via leaving a message on the phone never got a response. Versus using the technology that we have available to us today, it's a more open dialogue between my doctor and me. I can actually feel like it's my doctor, not just a doctor.
It helps, between those visits to help communicate with the doc, get prescription refills and things like that. With my job, it's hard to break away from the office sometimes, so anytime I can get anything medically knocked out without having to physically come into the doctor's office, it's an advantage for me.
Well, I think secure messaging offers our patients a unique and a new way to have better access to us and to our care team. Secure messaging has really changed the whole relationship between how our team works together, between my nurse and myself and other members of our team. And it's made us more available to our patients, so they're able to get quick questions answered, as well as the ability to make appointments without repeated phone calls and long phone trees, been able to get med refills done, late at night before they go to bed after the kids are asleep. And so it's been much more convenient for them, and it's been much more convenient for us because it allows us to respond to those in a timely manner, but also when it's more convenient for us during our day-to-day workflow.
Well, secure messaging helps patients take care of their healthcare needs when they don't necessarily need to be in the clinic. I have a patient, for example, who I've been managing for fibromyalgia type of symptoms. So over a two-month time, I may have spoken to her via email maybe 2-3 times a week, and maybe had seen her only once. So what we ended up doing is we worked from her symptoms, managed her medications to a point where she was feeling much better. She was keeping me in the loop as far as how she was making adjustments to satisfy her needs, and we were making our plans that way. So it worked out really well for her because she runs a business, and she's very busy and probably works very long hours, at least 12 hours a day. So it worked out really well for her.
I love using secure messaging. It's wonderful, it's convenient, it's fast, and I can get more out quicker to more people this way than I can dialing on the phone trying to speak to them.
We would not want to be without secure messaging. We truly would not. It has totally changed our life. And I can say to those that aren't computer savvy and email savvy, it's very easy.
The other thing I think about secure messaging is that it really opens up for patients a way to use the healthcare system that they hadn't even thought about in the past. I think in the past patients have thought, well, in order to see the doctor, I really have to have something important. And that may have left a lot undone. Now, because secure messaging is so easy, patients can ask a question after I've seen them about a medication or about a diagnosis or a referral or follow-up that they may not really have felt they had an opportunity or an avenue to address in the past. And that, I think, really does two things. It increases their connection with us as their healthcare system. I think it definitely increases the quality and effectiveness of care after the patient's left the clinic. And I think just implants on the patient's mind that it's easy to use Army medicine. That's the bottom line.